note this video was filmed during the COVID-19 pandemic. For the latest maternity service advice and information about COVID-19, please visit our dedicated site at www.mtw.nhs.uk/COVID-19 maternity information. Learning to take care of your new baby can be quite daunting, especially if this is your first baby. You'll probably find that you have lots of questions, everything from how to hold your baby, feeding, nappy changing, dressing and more. This video will cover some of the common topics that new parents ask us about. Because of how underdeveloped we are when we're born, human babies are completely dependent on their parents to keep them warm, feed them and keep them safe. Every time you communicate with your baby and respond to their needs, you're reassuring them that they are safe. Touching them, rocking them, singing to them, all of these things will have a direct and positive effect on their brain development. The best thing that you can do for your newborn is to learn their cues and respond to their needs as quickly as possible. Each baby is different, and spending as much time as possible with them as a family unit in those first few weeks will help you to understand what each cue means. Babies are aware that they can't look after themselves, so they will always seek assurance that their parents are nearby to help keep them safe. Babies will often not want to be put down or left alone too much in those early days, and this is completely normal. You can't spoil your baby or get your baby into bad habits by picking them up and holding them a lot in those first few weeks. Picking up and holding your newborn baby for the first time is a big source of anxiety for new parents. But the more that you hold them, the more that you'll get used to them and they'll get used to you. In no time at all, you'll be picking up and holding your baby like it's second nature. The main principle you need to remember when handling your newborn is that it's really important to protect their heads. Babies are born with quite weak neck muscles, which means they can't hold their heads up by themselves. So whenever you are moving or handling your baby, do make sure to keep their head protected at all times. You will notice a couple of areas on the front and the back of your baby's head. These are called fontanelles or soft spots, and they'll feel like a gap. These are a natural gap that occurs in your baby's skull, which allows your baby's brain to grow. Try to be gentle with these areas when you're handling your baby and try not to apply too much pressure to them. Babies can't see much when they're first born, but they can make out face shapes. When you're holding your baby, this is about the perfect distance for them to just about make out your facial features. Over time, they will start to recognise your facial features, and they'll also recognise your voice, which is why talking to your bump in pregnancy is really important. Completely natural for baby to want to sleep close to you and to not want to be put down too much in those first few days. As we mentioned, this is completely normal and is baby's survival instinct kicking in to make sure there's always someone there to protect them. The safest place for your baby to sleep in the first 6 months is in a cot or a Moses basket in the same room as you. When you're putting your baby down to sleep, it's important that you put them on their backs with their feet to the foot of the cot so they can't wriggle down under any blankets that you put on top of them. And when you are putting blankets, making sure that it's tucked underneath baby's arms so again the blanket can't wriggle up in front of their face and stop them from breathing. If you have teddies or anything else in the cot, please take them out when baby goes to sleep. It's also best to keep baby lying flat when they go to sleep, so pillows or anything under their head aren't necessary. A lot of new parents often ask, but what if baby is sick in the night and they're on their back? Because of the shape of baby's heads, they naturally put their head to one side when they're lying on their back so they can breathe. So if baby is a little bit sick in the night before you get to them, it will naturally fall down the side and onto the side of the cot. Try to also ensure that baby doesn't get too hot while they're asleep. Keep their head uncovered, don't put any hats on baby during the night because if they do get hot, this is where they'll lose heat from. Try to keep baby's sleep environment free from cigarette smoke, including their bedding. Exposing babies to cigarette smoke is a risk for sudden infant death syndrome or SIDS. If you, your partner or any other members of your family are smokers, please remember that everyone should wash their hands after every cigarette and again before handling a newborn baby. It's also good to not hold baby against the same top you've just been wearing to smoke. If you choose to share your bed with your baby, there are ways that you can do this safely. Firstly, avoid covering them with your duvet. They should have their own blanket or sleeping bag to avoid suffocation. Do not share the bed with your baby if you or anyone else in the bed has smoked, had any alcohol, or taken any drugs or medication that make you feel excessively tired. Make sure your baby has enough space where you've put them in the bed. Try to make sure that it wouldn't be easy for them to roll onto the floor. Try to avoid any pets getting into your bed if your baby is there. And please also avoid falling asleep with your baby on a sofa or an armchair, where it is much easier for them to roll off and fall onto the floor or into a position where they could become trapped. You can talk to your midwife or health visitor about all aspects of safe sleeping, or access the Lullaby Trust for more information and support. It is recommended that you organise your car seat during your pregnancy and bring it with you to the hospital or birth centre when you are in labour. Each car seat is different, so do make sure that you read the manufacturer's instructions on how to fix it into your car and how to fit baby in there safely. Some retailers can give you a demonstration of how to do this when you buy your car seat. Make sure the measurements of the car seat are correct and that it is the appropriate size for your newborn. When fitting your car seat, it's important to note that the car seat must be rear facing. Your baby should be in the back seat. It is currently illegal for your baby to be in the front passenger seat of your car if that seat has an airbag. When putting your baby into their car seat, only have them in close-fitting clothes rather than in a thick coat. A coat or a blanket will make the harnesses less effective in an accident and can cause overheating. If it is cold in your car, then fix the harnesses first and then cover your baby with a blanket for the journey. Your baby's nappies will be a big source of interest for you and your healthcare professionals in the first few weeks of life. Your baby's poo will start out very thick and sticky and black. This is what we call meconium, and this is the very first poo that baby will do. As the week goes on, it will change into a more green colour, and then by the end of the week it will be bright yellow. The NCT have a really good resource to have a look at what is normal and what isn't normal. When you're changing your baby's nappy, whether you're at home or out and about, it's a really good idea to have them on a flat surface which isn't too high off the ground, just so they can't roll off onto the floor. It's also a really good idea to have a bag with all your essentials to hand wherever you may be. When you come to change your baby's nappy, start by washing your hands and then get your baby comfortable. Undo the bottom half of your baby's clothing and tuck it out of the way. Undo baby's dirty nappy, but don't take it away just yet. Gently holding their ankles, lift their bottom up and start to wipe the whole area with your cotton wool or wipes. For girls, it's really important that you always wipe from front to back to help prevent infection. Once you've cleaned the whole area, pat baby dry with a cotton wool and remove the dirty nappy. Lifting baby again by the ankles, slide a clean nappy underneath them. The side with the adhesive tags attached is usually the back of the nappy. Some nappies will also have a design on the front, but do double check your nappy pack for more information. Fasten the nappy by unfolding the adhesive tags and sticking them to the front of the nappy around your baby's hips. Attach it so that it is snug but not too tight. Where possible, fold down the top edge so that the cord is not in the nappy. Then you can wash your hands and redress your baby. Once your baby is born, their umbilical cord will be clamped and cut, separating them from your placenta. A small stump of cord will be left attached to your baby's belly button with a clamp attached to the end of it. It takes about a week, but this will slowly dry up and then fall off. There's no need to put any creams or powders or anything on the cord. It will dry up and fall off of its own accord. If you notice that the area around the cord has got dirty, then you can wipe it with a little bit of plain water and then pat it dry afterwards. In the first couple of days you may notice that the stump of cord weeps a little bit of dry old brown blood, but this is completely normal. Do let your midwife know, however, if you notice any fresh red bleeding from the cord, or if there's any pus or any sticky smelly discharge coming from it, or if the area around the cord looks red or inflamed. Try to avoid, where possible, anything that might rub against or irritate the cord, such as tight clothes or your nappy. We usually recommend to avoid bathing your baby in the first few days after they're born to help prevent them from getting cold and to also protect their skin. If you want to keep your baby clean before you start bathing, or you want to keep them clean in between baths, we recommend cleaning their face and neck and also their bottom in a process that we call top and tailing. When you are cleaning or bathing your baby, it's important that you keep the room you're in warm and close any windows or doors. It's also good to have everything that you'll need to hand before you start, just so they don't get cold and also so that you don't have to leave them unsupervised. When you do top and tail or bath your baby, we recommend just using plain water rather than adding soaps or oils. The water that you use in your baby's bath should be warm and not hot. The best way you can check the temperature is by using an elbow or a wrist. When you are putting your baby in the bath, you can support their head and neck using your arm, and using your other hand, you can gently swish water over them. It's really important to not leave your baby unsupervised for any length of time while they're in the bath. When you've finished, get them out and put them straight into a warm towel so they don't get cold. If you notice that your baby's eyes are sticky or they need cleaning, it's best to clean them using cooled down boiled water. Use a piece of cotton wool and wipe from the inside of the eye out, and then discard that cotton wool. Use a fresh one to wipe again. This will stop you from passing germs from one eye to the other. If there's anything in this video that you would like to discuss, then please contact your midwife.